Hello and welcome. You're watching the Health Talk session by Yashoda Hospitals. Not all cancers can be prevented, but there are certain things which we can do that might lower your risk. In India, about 75% of cases are presented at a later stage of cancer that leads to poor outcome. So let's discuss about lung cancer and, more importantly, its early detection in our today's episode. I'm Dr. Lakshmi and we have a special guest in our today's episode. He's Dr. Rakesh Panchal, consultant pulmonologist from UK. Welcome to the program, doctor.
Thank you very much.
So doctor, we know that lung cancer is one of the leading cause of death across the globe. So why do you think it is so common?
Lung cancer is a major killer worldwide. It's an important cancer which presents quite late, and at late stage and late presentation, often treatment options can be limited. Patients may not be as fit for treatment, including surgical treatment or oncological treatment, and therefore early identification, diagnosis and treatment is key.
So I think you bring a good point that early detection and treatment is the key. So how do you think we can implement this strategy?
So in the UK, we have undertaken targeted lung health checks. So that's involved going into high-risk areas where lung cancer is quite prevalent, and this has involved undertaking low-dose CT scans in high-risk patients such as those who are smoking above the age of 55 to 75, and through targeted lung health checks they found that about up to over 60% of patients have been identified at early stage 1 cancer. That means they could be, if identified early, they can be operated on and potentially cured of their illness, or if their cancer is identified early, they may be more fitter for oncological treatments. In the UK, lung cancer screening has now been authorised by the government and the UK National Screening Committee, where patients aged 55 to 75 who are high risk will be offered lung cancer screening.
So in general, doctor, which group of patients are at high risk to develop lung cancer?
So lung cancer happens in smokers but can also happen in non-smokers. So there are a particular type of cancers, for example adenocarcinoma, which can be associated with genetic mutations, and this has a number of treatment options available these days, so it's important to identify it early so that relevant treatment can be offered. The other benefits of lung cancer screening and targeted health checks are that it offers the opportunity not only to screen for lung cancer, but patients can be advised on smoking cessation techniques. So obviously smoking cessation is key to public health improvement and reducing not only lung cancer but many other illnesses such as heart disease, reducing risk of stroke, peripheral vascular disease, heart attacks, etc. Screening also offers the opportunity to undertake spirometry and identify other illnesses such as COPD, which can be adequately treated because the patients may be suffering from symptoms of breathlessness, wheeze and cough and other symptoms which can be mistaken for lung cancer. So screening offers the opportunity not just to pick up cancer but offer public health promotion, smoking cessation, undertaking breathing tests such as spirometry to pick up illnesses such as COPD and other lung health issues.
So doctor, as we all know that certain diseases and even cancer can be prevented by changing certain risk factors. So what are the lifestyle modifications that one can take up to prevent this?
So with any illness there are modifiable and non-modifiable risk factors. So non-modifiable things are like our genetics, whether we are male or female. There's nothing we can do about these. However, there are modifiable risk factors, so smoking cessation. So if we stop smoking, we're going to reduce our risk of not only respiratory problems, cancer, but cardiovascular illness as well. If we improve our exercise, so maintaining regular exercise, walking, going to the gym, this will improve our cardiovascular health and our respiratory health. And of course, obviously maintaining a good, healthy diet is always beneficial. So these modifiable risk factors will help our general health.
So doctor, as we know that smoking is the #1 cause for lung cancer, so how do you think we can help our patients with this concern especially?
In the UK, and I understand in India as well, there is now access to smoking counsellors and smoking cessation clinics. This is really important because by working with a health professional who can help you quit smoking, it's much more effective than trying to potentially do it alone. There are a number of different options available. There is electronic cigarettes and vaping products available which will help you to quit cigarette smoking, but also nicotine replacements. And I think one size doesn't fit all patients, and by referring yourself to a smoking counsellor or a smoking clinic, they can work with you to identify what's going to be most effective to help you quit smoking. Because we know if you can quit smoking, it has so many positive effects, not just on cancer, but cardiovascular and respiratory health and beyond.
So before ending this episode, doctor, what message you would like to give to our audience out there?
So it's important to maintain a healthy lifestyle, which involves regular exercise, a good diet, quitting smoking, and if you remain unwell with your respiratory health, so you have a prolonged cough, if you remain breathless, wheezy, it's important to see your doctor because there are a number of things that could be going on. You may have airways disease such as COPD, asthma, you may have infections such as tuberculosis, or you could even have, worst case scenario, have something like lung cancer. And if these illnesses are picked up early, then early treatment and intervention can be very helpful. So do see your doctor if required.
So thank you, Dr. Rakesh. It was wonderful having you here on our program today.
Great, thank you very much.
So this brings us to the end of this episode. Thank you all for watching us, and do join us for the next week as well. Until then, take care and stay healthy. Thank you.